The injuries athletes face often correlate to their age and sport. In today's video, we're going to cover a specific problem faced by growing athletes, apophyseal injuries. My name is Nathan Carlson. I'm a running specific practice owner. Let's dive into today's video. From birth through your teenage years, your body grows in size, shape, and strength. And your skeleton has specific locations where these adaptations occur. We have different types of bones in your body, one of those being long bones. These bones can be broken down into three distinct components: the diaphysis, the epiphysis, and the apophysis, with each carrying specific roles. Bone growth happens from your growth plates, also called your apophysis. The specific location is where your bones both grow wider and longer. These fuse or close during the early teenage years of girls and in the late teenage years of boys, and are uniquely susceptible to injury during your growing years because they're the weakest link. Research by Longo and colleagues compares the musculoskeletal system of children to a chain. In this analogy, your ligaments are the strongest link, followed by your muscles and tendons, and lastly, your growth plate. Your growth plate or apophysis is 2 to 5 times weaker than the surrounding structures. This is why you rarely see ligament tears, muscle strains, or tendinopathies in growing athletes. Their growth plates tend to take the brunt of the injuries, which is often termed apophysitis, or inflammation of your growth plate. Now, this can happen for a couple different reasons. It can be a chronic overload, someone's doing too much, or we can have an acute traction event where the tendon close to the growth plate tugs and pulls a little piece of the bone away from that location. This occurs at various sites throughout the body, specifically in bones that are under high amounts of stress. This includes multiple locations in your pelvis, more commonly known conditions like Osgood-Schlatter's disease, which is an inflammation of the tibial tuberosity, Sever's disease, an inflammation of the growth plate of the heel, Sindling-Larsen-Johansson syndrome, inflammation of the inferior pole of the patella, Little League elbow, apophysitis of the elbow, or Island's disease, inflammation of the base of the fifth metatarsal. It's important to remember these happen in growing athletes, which is important when we're trying to differentially diagnose if an athlete is coming in with an injury to the growth plate, the muscle tendon unit, or the bone. Let's go over a few of the differing characteristics. If you're dealing with a muscle strain, they're gonna have a specific mechanism of injury, and they might also have an increase in pain and swelling around the area. Tendinopathies, bone stress injuries, and most apophysitis are going to have a gradual onset of symptoms. Tendinopathies are going to be present over tendons. Bone stress injuries are going to be located over commonly stressed bones, with apophyseal injuries again being over those locations we already mentioned. If a patient comes in with pain over the tibial tubercle and they're a growing athlete, I'm going to expect this to be Osgood-Schlatter's, because this would be an odd location for a bone stress injury, an odd location for a tendinopathy in a teenager, and there isn't a muscle in that location for them to strain. Most athletes do really well with a conservative return to sport plan. However, if not diagnosed early, this can lead to premature closure of someone's growth plate, malalignment, or can vary the stresses on that area and lead to an actual bone stress injury. In my clinical experience, apophysitis is often associated with overtraining. You have a young, developing, potentially gifted athlete that is doing way too much and needs to have things reined in. Maybe the best treatment for apophysitis is to get them doing a little bit less while continuing to engage with their sport and their team. They can often still participate, but the loads need to come down a little bit. And the most challenging part of this injury is dealing with overzealous parents and coaches, some of which you might be able to influence and change, while others you're not going to be able to do anything about. There's 3 key treatment ideas I want you to incorporate the next time you treat one of these injuries. First, the athlete needs some education on pain. If you're dealing with someone in their early teenage years with pain from an activity that they enjoy, this is normally very stressful, and often it's the first experience with pain or a loss of function that they're having to deal with. So educating them on the fact that this isn't something that should be around forever. Often it goes away when you stop growing, and it doesn't mean that you have to completely pull away from your sport is important. Similar to the red flags of pain I've discussed before, I'm okay with athletes continuing to practice and participate if their symptoms are low level, meaning it's a 1 or 2 out of 10 or less. It doesn't force them to move differently. It returns to baseline within about 24 hours, and the athlete and probably the parent are okay with whatever it is that the athlete is feeling. It's helpful to have a progressive rehab program where you're stressing the affected area both to help build strength and capacity, but also to check and make sure It's ready to handle stress. If an athlete comes in with Osgood Slaughters and they can't do a bodyweight squat without significant pain, they probably can't be playing their sport. So a progressive exercise program that loads the area is going to be helpful to prepare the athlete for the sport and to check and see if they're ready. We want to incorporate some plyometrics prior to their return to sport as well. This includes both bilateral and unilateral variations specific to the demands of their activities. Lastly, we want a gradual return to practice and competition. You should be able to look at their return to sport and say, this is sensible. You're not immediately returning them to 3 practices in a week and 5 games on a weekend. I don't want the complications I've already mentioned with these injuries to happen, but I also want to make sure that the athlete still enjoys their sport. So we need to be sensible as we're progressing them back into things and making sure they have a good sense of how to navigate any symptoms or sensations that occur. Thanks for watching.